Welcome everyone to Interconnected. I am so excited to have my next guest, Dr. Suha. I would love for you to introduce yourself, Dr. Suha, and tell everyone a little bit about you and your work that you do.
Thank you, Jordan, for this invite today. My name is Suha. I am a holder of PhD in inclusive education and special education. It's recently, actually, I was awarded this certificate very recent, so I'm really excited about it. I hold master's degree since I would say 18, 19 years, and I've been working as a speech and language pathologist since that time. I am practicing as a speech and language pathologist, as a consultant in inclusion in Dubai since the last 18 years. It's been a rewarding experience, great journey. So I'm here to discuss all about it.
Thank you. First of all, congratulations. What an amazing accomplishment. And looking forward to diving a little bit deeper to learn more about your work. So that leads me to my first question. What strategies do you use to ensure that both the patient and their family feel involved and understood throughout the therapeutic process?
I think, having parents as like focal point of therapy is very crucial. When we work with children with difficulties, we are usually not the only people who are working with the kids with different difficulties. So there is the teachers, there is occupational therapist, ABA therapist, psychiatrist, psychologist, parents. So I feel like parents are keeping all of these people connected, and they're making sure that the plan is working on the same page for every one of these professionals. So to make sure that parents are at the core of my plan, usually before I set my goals, I meet with the families and I ask them, what is your concern and what do you want your child to learn? Like the first goal that comes in your head, sometimes the goals are not realistic. So we work towards them with suggesting like short term goals and goals that we can build to reach what they are looking for. But usually they are involved in the plan since the beginning. Like they are, since the first day they visit me for the assessment, I make sure that they are focal point in the therapy. We usually have discussions at the end of each session. We have the progress report discussions. We have the MDT discussions with all other professionals when we meet all together to discuss the progress in general. We have the student teachers meetings. We are usually involved with the students, with the teachers, and with the parents. So I would say that they've been always important part of planning the therapy and of they take on our goals to the home after we finish. So I don't know, like we usually say that I work with your child 2 hours 3 hours per week, but you work with your child 24 hours 7 days a week. So I give them the beginning, but they continue to do the work, and I always make sure that they are ending up as therapists. So when I finish with this family, I know that I graduated a therapist, like not a parent only. So yeah, this is what I do.
I love that. You brought up a lot of huge points. One being that you're setting the tone when you first initially meet with the parents and allowing them to feel included from the very beginning. And also, too, empowering them with different tools along the way so that it's not just in your therapy room that their child is receiving therapy, but also at home, there's tools that enable the parent to feel that okay, I don't have to wait for Dr. Suha to work with my child next time. I can continue to work with my child at home, and I have these tools that she's provided. So I think that's
Right.
really awesome to start set the tone like that, and then also to providing them with the tools. So my next question is, with your extensive background in speech and language pathology, how do you stay updated on the latest research and innovations in the field?
So, like number one, we have mandates that we have to have hold a license, and this license has to be renewed every 2 years. And to renew this license, you need certain CPD or CME hours. So you need to go to certain workshops, you need to attend certain lectures, you need to do certain numbers of hours in the field of speech and language pathology, and this is for sure helping you to be updated. However, I feel like my personal interest usually divert towards the AAC. Like I feel like I'm one of the speech therapists who loves to look at communication and how AAC and recent technology can help different kind of difficulties like ASD, for example, and the use of AAC and how we can use nonverbal children to use these communication tools. It's not only speaking, how I can advocate for the right of communication. Maybe I'm talking about where I'm coming from now in the UAE. And I'm sure you've encountered parents who feel like sometimes when we say AAC, it means that we're giving up on language. And I work really hard on advocating on what is AAC and how is certain research like supporting the use of AAC, how communication can support the speech. When you use PICs, when we used to use PICs in the old days and we developed to use Proloco and other devices now. I mean, we've gone really long way. If we didn't work hard as a speech and language pathologist to develop from PICS to Proloco, now we'll be like, what is it and how we can use communication tools. And using PICS was like pain for us. I know that losing one picture from PICS book was really hard, but keeping yourself updated has helped me personally really much in moving from using this to using that with keeping the same principles of communication. Like, yes, I moved from PICS to using Proloco, for example, but I still use the 7 phases of PICS. Like, the child has to initiate, the child has to come to me, the child has to go to get his iPad and come and press at what he wants and use the sentence and so on. So I feel like, in this area specifically as a speech and language pathologist, I have like exposed myself to a lot of research and information to keep up with the change in technology that I've encountered as a professional.
Yes, and you brought up a really good point in terms of, you know, providing context of why you're doing what you're doing allows for, parents or other specialists to be able to understand, okay, based on this approach, this is why I'm using it with this particular client. And I think the context really helps to be able to understand from a different perspective. And sometimes our field is very technical. And a lot of times, if you're not familiar with a lot of the language or the different program or whatever approach that the therapist is using, context really does provide that information to be able for a parent or another professional to be able to understand why
I
you're doing
agree.
what you're doing.
Yes, yeah. And
Yeah.
we make sure that we avoid this jargon with parents. Like, when we want to say communication tools and we want to say that the child needs AAC, why we say the assistive and augmentative, not only assistive, how does that reflect in the child's everyday life? I think it is very important not to use the jargon when we are with the parents. However, we need to support with research. We need to show them what the research says in this area. So yeah, I like this discussion, Jordan.
I do too. Yeah, this is really good. So how important, you touched on this a little bit earlier, and it seems like it's almost embedded in the work. How important is it to involve educators, healthcare providers, and families in the treatment process? And maybe you can speak more to examples of successful collaborations.
Yeah. So I used to use the term generalization. Like, I don't want the child to learn in my clinic only. I don't want the child to know how to request for something only in my room. I want the child to use this way of communication or this function of communication which is requesting in other areas. So I want this child to be able to request his wants and needs in the school. I want the child to be able to request his needs and wants at home and with his caregiver on the beach, in the mall, even when he's in the swimming pool. So what I do usually is I share my recommendations with the school. So, for example, my goal is to work on requesting using 3 words phrases. I want water, for example. So, what I do is I go to the school, I do observation in the classroom, and I meet with the classroom teacher and I say, hey, he knows how to request. He just needs to be pushed. If he says water, don't accept it. Let him just say a sentence. So, and I give these simple strategies to the teachers. I do the same at home. Sometimes kids are resistant outside the clinic, and this is really crucial that the child shouldn't learn only with Suha. This is what you say with Suha, and when you go outside, you use one word. That is not acceptable. So I used to have everyone with me on the same page. And, now with the technology and having these school communication tools that you can just upload your recommendations there and the teacher can respond back to you with the parents always with you after the sessions. You're like, he used this today in the clinic. I want him to use it for the next 2 days at home. And when they come back before the session, I ask them, how was it? Did he use it? What happened? Did he tantrum before? Did you push it? Was it spontaneous? How many times he said it? And I collect data. Sometimes I also give parents and teachers some data collection sheets and to tell me how many times the child used it and was he successful in using the goal he mastered in my clinic. 90% of the times he is requesting using 3 words phrases. Is he doing the same at school and at home? If not, then I have not reached my goal yet. Otherwise, it is just, he's just using this with Suha and it will not help him in his life. So I make sure that they are really part of the therapy, part of the recommendations. I check on with the parents and with the teachers before and after I do regular visits to the school. I feel like it has to be this comprehensive when you want to do therapy for children.
I couldn't agree more. I wanted to ask you regarding more specifically to some of your work that you've published. And what do you consider your most significant achievement along your journey and why?
I think the most significant achievement is my PhD. I think I've done it as a mother of three, as a working mom, and as a student in the university. I've done really hard to achieve my PhD over 4 years. Part of them was during the COVID era, and that was really hard time to do my studies while the kids are at home and I work from home. It was really hard, but I can't tell you how much I'm proud of this achievement. It is like the best thing I've done. From my publications, I feel like one of the studies we did in Al Jalila Hospital during my time when I was working there, it was about the parents' perceptions on the ASD services in the UAE, and it was very important to collect some insights from the service users. What do you think about the availability of resources? What difficulties you are encountering? And how we can support you. And I think this study was one of the interesting studies I've published. Plus that I provided the Arabic speaking community with a lot of resources. Resources are available in English, however, there is really lack of services in Arabic. So I had some communications with Autism Speaks, and they agreed to give me, I was really lucky to have this agreement with Autism Speaks that I can translate these documents to Arabic. And now I'm sure that Arabs are using them. Not all Arabs can speak English, not all Arabs can read English, not all Arabs can understand, what is published in other languages. So it was really great to have these resources in English, in Arabic.
Yeah, having it in different languages because things can translate completely different, as well as just being able to really get the information that's necessary to be able to help the parent feel empowered as well as help for them to feel empowered to be able to help their child as well with these resources in Arabic. So that's great that that partnership worked out as well, and that just from reading the work that you're doing, you continue to be able to translate a lot of the publications that you do in Arabic. Are there any innovations or any work or resources that you've come across that you found like fascinating, or what's exciting you right now with all of the different innovations that are happening in the field?
I worked with some patients with rare disease, and using the eye gaze in the AAC was really a breakthrough for one of the patients. So the patient was not moving at all. We couldn't use any communication tool, and the eye gaze was really amazing. Like when I used it, I was like over the moon. So I tried it at the beginning at me before I tried it on the patient because, it is quite expensive. So I went to the company where they sell the AAC equipments, and I was like, oh, listen, I have all of these difficulties with this child and we need to help him. Like technology is everywhere. Like now we're driving cars without driving. So come on, like the child should communicate. And it was great to have the eye gaze. I think it's a breakthrough. I think it was very helpful for this child who was not moving his hands, was not able to move his legs, his hands, and his head. We couldn't do anything except the eye gaze, and the eye gaze was like the thing that made his life easier. He was happier actually. Like after a few trials, I could see that the child was happy. You could see that he felt more relaxed and the family was less tense and the whole environment was completely different. So I feel like this one made a lot of difference for me. Like we have always to try as a speech and language pathologist to find a way for our patients, clients, whatever we want to call them, to help them to communicate. If they communicate, speech will come or will never come. It depends. But at least you are giving them a right to communicate.
I love that. Yeah, that's a powerful story. It's true. Really maximizing on different resources, and you can tell just how passionate you are ensuring that every client that you work with gets what they need in order to be successful, as well as their family. Well, I have so many more questions, but I know we're we're out of time. So I wanted to give you a chance to be able to share where people can keep up with the work that you're doing and follow any of the latest publications too that you may be releasing soon.
So I am located in Dubai, in a very popular place in Dubai called Dubai Healthcare City. And my own clinic, C37, I have Instagram page. I am available there, TikTok, LinkedIn. You can just search my name and my publications will be seen. Usually my publications are open access, so you'll just find it and you will benefit from it, especially the ones that are translated to Arabic. I made sure that when I did the agreement and the partnership that they're available across the world. Any Arabic speaking who needs resources in these areas will find it. And I'm hoping for more. Actually, I'm working for more to come. And yeah, this is how you can find me. This is my social media.
Thank you so much, Dr. Suha, for taking the time to share about yourself and all of the incredible work that you're doing. And thank you all for tuning in.
Thanks for inviting me. It was really exciting to talk about speech